Why do some drug therapies work for some patients but not for others? It's a question that has plagued the medical community in the past, but now scientists have the answer. In part, it is found in your DNA. Not only can genes determine whether you're likely to develop a particular illness, but they can influence how your body responds to certain drugs and therapies. Doctors prescribe medications based on their diagnosis, which is a process that pulls together many sources of data, such as a patient's history, symptoms, test results, and so on. When doctors can include genetic information in their diagnosis, they are able to tap into a powerful source of information, which can deliver better medical outcomes. It's called personalized medicine, and experts believe it's ushering in a new era in healthcare.
Well, personalized medicine is managing the healthcare of you, the individual, looking at how you respond to the medications, not based on averages over large populations. It's changing healthcare because it changes the way a physician manages the patient. This can help prevent bad reactions, adverse reactions, minimize side effects, suggest dosing for drugs, and even suggest alternative drugs that you're more likely to respond to.
Simply, personalized medicine customizes healthcare in an individual way, with medical decisions tailored to each patient based on his or her unique genetic makeup. In the past, doctors would often use a trial and error approach to medicine. In this way, they were never sure whether patients would benefit from treatment and why some patients responded and others did not. Today, almost everyone can benefit from the technology behind personalized medicine. One area which this approach is particularly useful is the field of mental health.
Some of the main challenges in prescribing medications to our psychiatric patients has been a lot of trial and error in terms of what medications patients are going to respond to. Are they going to have side effects to certain medications? Dosing has been a challenge. With the genetic testing, we are able to now identify how a person may actually respond to a given medication. We are able to determine whether or not they are predisposed to experiencing certain side effects. This testing is going to help us with determining appropriate dosing, primarily because our patients have a tendency to perhaps be hypermetabolizers or undermetabolizers, and this in turn will drive the actual dosing of the medication.
With genetic testing, we can now identify specific genetic changes to help select the most appropriate treatment for a patient's particular needs. This is better known as pharmacogenomics. This testing is performed on blood samples or cheek cells from a patient. As a vital tool for psychiatrists, cardiologists, oncologists, and other disease specialists, pharmacogenomics can help doctors predict which therapies a person will most likely respond to while reducing side effects.
Oncology has a history of using genetic and molecular technologies to determine treatments. And what's different about pharmacogenomics, which has changed what we're doing, is we're looking at how these drugs actually work on the patient, not just in response to treatment for a particular disease, but side effects and whether a particular drug would be beneficial. It's a lower level of technology at the cellular level that allows us to look at predictability of responses for treatment.
By identifying genetic changes in cancer tissues, companion diagnostic cancer testing can help doctors to decide which therapies individual patients are more likely to respond to. This approach is being successfully used for many patients with cancer, particularly certain skin, breast, and blood cancers. Pharmacogenomics can also help doctors to select treatment plans that reduce side effects, thus making it easier for patients to cope with and complete necessary treatment. Moreover, and more importantly, it can predict which patients are likely to experience life-threatening adverse drug reactions that can lead to hospitalizations and deaths. As cancer companion diagnostics and pharmacogenomics testing is a fairly new trend in healthcare, experts believe we've just scratched the surface about how personalized medicine can change the industry. Companion DX is a worldwide leader in personalized medicine. Through accurate and reliable screening of genetic changes, Companion DX helps doctors and patients to make better and more informed decisions about healthcare. Companion DX is a reliable genetic testing partner, providing doctor-approved treatment recommendations. In addition to pharmacogenomics testing and cancer companion diagnostics, Companion DX delivers state-of-the-art colorectal cancer screening through a simple blood test. Although not a substitute for colonoscopy in patients who meet the recommendations, this colorectal cancer screening complements this medical procedure and may indicate patients who should immediately undergo colonoscopy that have failed to get one. It may also be useful for patients who are unable to tolerate this screening procedure.
The mission is to pick up colon cancers early when we can treat them more effectively. If a tumor is confined to the wall of the colon in its earlier stages, it can be cured surgically, and there's a 90% 5-year survival rate.
The Companion DX colorectal cancer screening test may help to detect colorectal tumors early, when there is a better chance that treatment can help these patients to live longer. Genetic testing from Companion DX is a powerful healthcare tool in this new era of personalized medicine.
I prefer Companion DX because of the multidisciplinary approach to the results. And what I mean by that is not only do I get the pharmacogenomic data, but I get an interpretation of how to use that data for my particular patient.